Hi guys, welcome back again for another video. So for today's video, we're going to do the return demonstration of Otic installation, ophthalmic installation, oral administration, and subcutaneous injection. So for the first procedure that I'm going to do is the administering Otic installation. So first is we need to do the assessment. So sa assessment is we need to assess yung mga related to the administration of any medications, yung appearance ng pina of the ear, and then yung meatus for signs of redness and abrasions, and also yung type and amount of any discharge. So for the equipment, we're going to need the client's MAR. Clean gloves. We're going to need also a cotton tip applicator, correct medication bottle with dropper, and flexible rubber tip, and also a cotton cuff. So, next is we need to prepare. So, we need to check yung ating client's MAR. So, i-check natin yung drug name, yung strength, yung number of drops, and also yung prescribed frequency. And then, i-check din natin si ating client for the allergy status. So, if yung ating MAR is unclear or merong mga missing information, so we need to compare it dun sa most recent primary care provider niya, which is written doon sa order. So, we need to report yung mga any discrepancies doon sa charge nurse or doon sa ating primary care provider. So, next is we need to know the reason why the client is receiving yung gantong medication, yung drug classification, contraindications, yung mga usual dosage range, yung side effects, and yung mga nursing consideration for the administering and evaluating the intended outcomes of the medication. So, binibigay po natin to sa ating mga patient na merong ear infection. So, nag-a-administer po tayo ng mga medication. So, next is we need to compare yung label na medication container with the medication record, and i-check natin yung expiration date. Okay, expiration date. Okay. And next is, if necessary, we calculate yung medication dosage. So, explain natin sa ating client what you're going to do and why it's necessary and how the client can participate. So, yung administration ng Otic medication is not usually painful. So, we need to discuss how the result will be used in planning for further care of our treatments. Next is we need to perform hand hygiene. And provide the client's privacy by closing the doors or closing the windows, and prepare yung ating client. So, prior for the procedure, so we need to introduce ourselves, verify the client's identity, and i-assist natin si ating patient on a comfortable position for eardrop administration. So, for the position is we need to lying the patient with the ear being treated the outermost. So, ito po yung ating iti-treat na infection, yung kanya pong right ear. So, hello po sir. My name is Charlotte Buena Bustamante, your student nurse for today. Ano pong pangalan nila? Okay po. Mr. Brown, ang gagawin po natin yun sa inyo is maglalagay po ako ng medication doon sa ear nyo. Okay lang po ba sa inyo? Okay po. So, i-assist ko lang po kayo in the side into a lying position. Okay po? Kamusta po kayo? Okay lang po ba yung position nyo? Okay po. So, next is we need to clean yung pina of the ear and yung meatus of our ear canal. So, we need to apply the gloves if merong infection is suspected. So, mag-a-apply na lang po ako ng gloves since meron pong infection sa ear po ng ating patient. Okay. Okay, so next is we need to use the cotton applicator or yung ating cotton tip. So, it is sterile. So, open lang po natin. Okay, then kuha po tayo ng isa. So, with the use of our cotton tip applicator, so assuming na meron na po siyang solution, so we need to wipe po yung pina and auditory meatus ng ating patient, and we need to ensure that yung applicator is hindi po papasok dun sa ear canal ng ating patient. Hold lang po natin yung ear ng ating patient, and then lilinisin po natin pina, and then sa meatus. Okay. So, once na nalinis na is we need to discard this. After po natin malinis yung pina and yung ating meatus ng ating patient is we need to administer yung ating ear medication. So, we need to warm the medication container in your hand or we place the medication in a warm water for a short time. So, partially, if you fill po natin yung eardropper with medication, so, assuming na meron na po tayong eardropper, and then, we straighten po yung ating auditory canal. So, we need to pull the pina upward and backward for clients over 3 years old. So, we need to instill yung correct number of drops along the side of our ear canal. So, again, pull and then backward for over 3 years old. And then, maglalagay na po tayo ng few drops or dun sa prescribe po ng ating physician. And then next is we press gently but firmly a few times on the tragus of the ear. And then we need to ask our patient to remain in the side-lying position for about 5 minutes. Okay. Sir, okay lang po ba na ganyan po muna yung position nyo for 5 minutes? Okay po. So, next is we need to insert a small piece of cotton puff loosely at the meatus of the auditory canal for about 15 to 20 minutes. So, hindi po natin ipipress yung ating cotton doon sa ating canal. So, after applying yung ating ear medication, we remove our gloves and we dispose. So, we need to perform hand hygiene and i-assess natin yung client's response and yung character and also yung amount of discharge, appearance of the canal, discomfort, and so on. So, immediately after the installation, again, when the medication is expected to act. So, we need to inspect yung ating cotton ball for any drainage. And we need to document all the necessary information such as yung ating mga nursing assessment, yung intervention relative or related doon sa ating procedure and include natin yung name ng drops, if a liquid medication, yung time and also yung response ng ating patient. So, for the next demonstration that I'm going to do is administering the ophthalmic installation. So, first is we need to do the assessment. So, sa assessment is we need to check or yung appearance ng eye ng ating patient, surrounding and also yung the structures for the lesions, exudate, erythema, or swelling, yung location and nature of the any discharge, lacrimation, and swelling of the eyelids or the lacrimal gland. So, sir, assist lang po. Okay. And then next is we need to assess yung ating client's complaints such as yung itching, burning pain, yung blurred vision, or yung photophobia. And then, i-assess din po natin yung ating client's behavior for the blinking excessively, yung frowning, or yung rubbing of the eyes. So, next is our equipment. So, our equipment is we're going to need the client's MIR. So, we need also clean gloves, a sterile absorbent sponges, soap in sterile normal saline, a medication, and also yung sterile eye dressing pad as needed, and the paper tape to secure it. So, for the next is the preparation. So, again, we need to check yung ating client's MAR. So, check natin yung medication administration record ng ating client for yung drug name, yung dosage, and yung strength, and also, we need to confirm the prescribed frequency of the installation and which eye is being treated or kung saan po yung eye na lalagyan po natin ng ophthalmic installation. And also, we need to check yung ating client's allergy status. And then, if again, yung ating MAR is unclear or meron pong information na missing, so we need to compare it in the most recent primary care provider's written order. And we need to report yung mga any discrepancies doon sa ating charge nurse or doon sa ating primary care provider. So, next is we need to know the reason why the client is receiving this medication, yung drug classification, yung contraindications, yung mga usual dosage range, and yung side effects, and also yung ating nursing consideration for the administering and evaluating the intended outcomes of the medication. So, and now, let's proceed to our procedure. So, first is we need to compare yung label ng medication tube or yung bottle with the medication record and check yung ating expiration date. Okay, the expiration date is 10/27/2022. Okay, And then, if necessary, is we need to calculate the medication dosage na ibibigay natin sa ating patient. And next is we need to introduce ourselves, explain what we're going to do, why it's necessary, and explain sa ating client how she or he can participate in this demonstration. So, yung ating administration ng ophthalmic medication is not usually painful. So, yung mga ointments or yung mga soothing to the eye, but some liquid preparation may sting initially. So, we need to discuss how the result will be used in the planning further care or treatments. So, hi sir, my name is Charlotte Wenavi Bustamante, your student nurse for today. So, what is your name again, sir? Okay. So, Mr. Brown, ang gagawin po natin sa inyo is maglalagay po tayo ng medication doon po sa inyong mata. Okay lang po ba yun sa inyo? Okay po. So, next is we need to perform hand hygiene and observe other appropriate infection prevention control. And we need to provide the client's privacy by closing the doors and closing the windows. And then we prepare our client. So, prior to the procedure, so we need to assist yung ating client to a comfortable position. So, usually, it is a lying position. Okay. Sir, higa po kayo. Okay. Sir, okay lang po ba kayo? Okay. So, assist ko lang po kayo. Okay. After that is we need to clean yung eyelid and yung eyelashes ng ating patient. So, we need to apply clean gloves. So, after we apply the clean gloves, so we need to use sterile cotton balls and we moisten it with the sterile irrigating solution or normal saline. So, and we need to wipe yung ating eyelids ng ating patient from inner canthus to the outer canthus. Okay? So, inner canthus to the outer canthus. Okay? And then next, inner canthus to outer. Okay, and we need to discard. So, next is we need to administer yung eye medication doon sa ating patient. So, we need to check yung ating ophthalmic preparation for the name, strength, and number of drops of a liquid is used. So, we need to draw the correct number of drops into the shaft of the dropper if yung dropper is gagamitin natin. If the ointment is used, so we need to discard yung ating first bead. So, we need to instruct our patient to look up to the ceiling and we need to give the client a dry sterile absorbent sponge. Okay. Sir, tingin lang po kayo sa taas. So, ito po yung inyong dry sterile absorbent sponge. Okay. So, next is we need to expose yung ating lower conjunctiva sac by placing my thumb or fingers doon sa cheekbone ng ating patient. So, i-drawing down lang po natin. And then, using my dominant hand is i-hold natin yung medication and we need to place yung ating hand doon sa forehead ng ating patient to stabilize yung hand. And we need to approach yung eye from the side and instill yung correct number of drops onto the third o doon sa outer third of the lower conjunctiva side. So, we need to hold the dropper for about 1 to 2 cm above the sac. Okay, next, on the other side. So, we need to... Okay. Okay, after that is we need to instruct our client to close the eyelids but not squeeze them shut. Okay. Sir, pikit lang po kayo. Okay po. And for the liquid medication, so we need to press firmly or have the client press firmly on the nasolacrimal duct for at least 30 seconds. Okay. Sir, ipipress ko lang po Okay. After that is we need to clean or dry yung eyelids as needed. And we need to wipe yung eyelids gently from the inner to the outer canthus to collect yung mga excess medication. Okay. And then after that is we need to remove and discard yung ating gloves. And we perform hand hygiene. And we need to apply yung iPad if needed and we need to secure it with a paper eye tape. So, we need to assess yung ating client's response immediately after the installation or yung irrigation, and again after the medication should be acted. So, we need to document all the relevant information such as yung ating nursing assessment, yung mga intervention na binigay natin sa kanya, And also, we need to document yung name ng drug, yung or ng irrigating solution, yung strength, and also yung number of drops na binigay natin sa ating patient, and also yung time, and also yung kanyang response. So, for the next demonstration that I'm going to do is yung administering oral medication. So, first is the assessment. So, sa assessment is we need to assess yung ating patient for allergies to medication, yung ating client's ability to swallow yung medication, yung presence of vomiting or diarrhea that would interfere yung ability to absorb yung medication, and also i-assess din po natin yung specific drug actions, yung side effects, interactions, and yung sa adverse effects. And we need also to assess yung ating client's knowledge and yung nursing or yung learning needs about the medication, and we need to perform appropriate assessments such as vital signs, laboratory results for the specific medication. So again, for our equipment is we're going to need the client's MAR, yung dispensing system, yung disposable medication cups, or yung small paper or plastic cups for tablets and capsules, or wax or plastic calibrated medication cups for liquid. So we need also to use the pill crusher or yung cutter, and then straw to administer yung medication that may discolor the teeth to facilitate yung ingestion of liquid medication for the certain clients. And also, kailangan din natin ng drinking glass of water or juice or bottled water. Oh, and we need also the soft foods such as yung applesauce or pudding to the used for crust medications for clients who may choke the liquids. For the preparation, so again, we need to know the reason why the client is receiving the medication, and yung drug classification, contraindication, yung usual dosage range, yung side effects, and also yung nursing consideration for the administering and evaluating the intended outcomes of the medication. So again, is we need to check yung ating client's MAR. So i-check natin yung drug name, the dosage, the frequency, yung route ng administration, and also the expiration date for the administering the medication if appropriate. So again, so ito po yung ating medication sa kanya. So, okay. Next is we need also to, if yung ating MAR is unclear or yung merong mga information na missing, so we need to compare the medical or medication administration record with the prescriber's most recent written order. And we need to report any discrepancies doon sa ating charge nurse or doon sa ating healthcare provider. And next is we need to verify yung ating client's ability to take the medication orally. So, we need to determine whether yung client is nakakalunok. So, if NPO or if yung ating patient is nauseated or vomiting or meron siyang gastric suction or diminished or absent yung kanyang bowel sounds. Okay? And next is we need to organize yung ating supplies. So, we need to gather yung ating mga MARs for each client together. So, together the medication can be preferred for one client at a time. Next is let's go for the procedure. So, again, for the procedure, so we need to perform hand hygiene and observe other appropriate infection prevention procedures. And next is we're going to unlock yung ating dispensing system. So, we need to obtain yung appropriate medication. So, we need to read yung ating MAR, and we need to take yung appropriate medication for the shelf, drawer, or refrigerator. So, we need, yung medication may be dispensed in a bottle, box, or unit dose package. We need to compare yung label ng medication container or unit dose package against dun sa order, doon sa MAR, or dun sa computer printout. So, if magkaiba po, so we need to recheck yung ating prescriber's written order in the client's chart. So, if there is a still discrepancy, so we need to check yung nurse in charge or yung sa ating pharmacist. Okay? And then, we need to check yung expiration date of our medication, and we need to return the expired medication doon sa pharmacy. We need to use only yung mga medication na clear at yung mga nababasa. For the next is we need to prepare yung ating medication, so we need to calculate the medication dose accurately, and then yung correct amount ng medication for the required dose without contaminating yung ating medication. So, while preparing yung ating medication is we need to recheck each prepared drug container with the MAR again. So, for the tablets and capsule, we need to place the package unit dose capsule or yung tablets directly doon sa ating medication cup. So, ilalagay po natin siya dito. So, we do not remove yung ating medication from the package until nasa bedside na po siya. After preparing yung ating medication, so we need to provide yung client's privacy by closing the doors or closing the windows, and we need to prepare our client. Again, we need to introduce ourselves, verify the client's identity, and assist yung ating client on a sitting position, or if not possible, is side-lying position. So again, sir, my name is Charlotte Wenavi Bustamante, your student nurse for today. So ano po pangalan nila ulit? Okay, so Mr. Brown. So, si Mr. Brown is kailangan niya po ng oral medication. So, assist ko lang po kayo into sitting position. Okay. After positioning our patient on the sitting position is we need to explain yung our purpose of the medication and how it help using language that the client can understand. So, ang ibibigay ko po sa inyo is paracetamol para po yun sa lagnat po niyo. Okay lang po ba yun sa inyo? Okay po. And then after that is we need to administer yung medication natin at the correct time. So we need to take yung ating medication to the client with the guidelines. So ilalagay na po natin siya. And then ito po yung ating medication. And then sir. Okay. And then ito po yung bottle of water. So if yung ating patient is unable to hold yung ating cups or yung ating medicine cup, so pwede po tayong mag-assist sa kanya. If yung mga older child or yung ating mga adult clients is difficulty on swallowing, so we need to ask yung ating client to place yung medication doon sa back tongue before taking the water. After giving the medication, so we need to stay with the patient until all the medications have been swallowed. So yung nurse is may need to check yung client's mouth to ensure that yung medication is swallowed and hindi po siya nakatago inside the cheek of our patient. And then next is primary care providers or their agency is required for the medications left at the bedside. So next is we need to document each medication given doon sa ating patient. I-record po natin yung medication given, the dosage, the time, yung mga any complaints or assessment of the client, and also the signature. Also, we need to document if yung medication was refused by our client, and we need to record this the fact appropriate record. And we document kung anong reason when possible and yung nurse's actions according to the agency policy. And next is we need to dispose all the supplies appropriately. So we need to replenish yung stock, and then also i-return yung ating cart appropriate place. So, and we need to discard yung mga used disposable supplies. For the evaluation, so we need to return the client when the medication is expected to take. So, usually 30 minutes, okay na siya, to evaluate yung effects of the medication on the client. Okay, so we need observe yung mga desired effect such as yung relief of pain or na-decrease ba yung body temperature. And we need to report yung mga significant deviations from normal to the primary care provider. Okay. Sir, kamusta po kayo ngayon? Okay lang po ba kayo ngayon? Hindi naman po kayo nahihilo, nagtatae, nabawasan po, okay? Kamusta po yung pakiramdam nyo? May init pa po ba? Okay po. Okay, so for the next procedure that I'm going to do is the subcutaneous injection. So first is we need to do the assessment. So sa assessment is we need to assess yung ating allergies to medication, yung specific drug action, side effects, and also the side reactions. So also we need to assess yung ating client's knowledge and learning about the medications, yung status and appearance of the subcutaneous site for lesions, erythema, swelling, or inflammation, and yung tissue damage from the previous injections. So, we need also to assess yung ability to client to cooperate during the injection, and we need to assess yung previous injection site use. So, next is for the equipment. So, kailangan po natin yung ating client's MAR, yung ating normal saline, and then kailangan din po natin yung ating 3cc or 3 ml, yung ating antiseptic swab or cotton balls na merong alcohol, and then kailangan din po natin ng clean gloves. So, next is we need to check yung MIR ng ating patient. So, i-check natin yung label ng medication carefully against doon sa ating MIR. So, and we need to also make sure the correct medication is being prepared. Okay, normal sodium. Okay, normal. Okay. And the next is we're going to follow the 3 checks in administering the medication. So, first is we need to read the label of the medication when it's taken to doon sa ating medication card. Before withdrawing ng ating medication and after withdrawing ng ating medication is kailangan natin i-check yung ating client's MAR. And we need to organize yung ating equipment. Okay. So, tanggalin na po natin. Okay. And then, naka-open na po yung ating normal saline. And next is we need to perform hand hygiene. And we need to prepare yung ating medication from the vial or ampule for drug withdrawal. So, if yung medication natin is insulin or heparin, so we need to check yung dosage needs to be verified by the another nurses. So, maglagay na po tayo ng medication. Bigay po tayo ng 1 ml. Okay. 1 ml. So, check po natin kung nagana po yung ating syringe. And then, 1 ml. So, pag may bubbles po, pwede naman po natin ibalik. And then, mag-withdraw lang po tayo ng 1 ml. Okay. And we need to tap para mawala po yung mga bubbles. Okay. So, 1 ml na po. Okay. So, 1 ml na po. So, i-recap po natin siya. Okay. And then, after that is prior for the procedure. So, we need to provide the client's privacy by closing the doors or closing the windows. And we need to prepare our client. So, prior for the procedure is we need to introduce ourselves, verifies the client's identity, and assist yung ating patient on the position, comfortable position, which is yung arm, leg, or yung abdomen natin is can be relaxed depending dun sa site na gagamitin natin. My name is Charlotte Benabi Bustamante, your student nurse for today. So, sir, ano pong pangalan nila? Okay, Sir Brown. Sir Brown, ang gagawin po natin sa inyo is mag-administer po tayo ng medication through subcutaneous injection. So, we're going to use yung arm nyo po, sa likod po ng arm nyo, since marami pong fat doon. And we administer it by 45 to 90 degree angle. So, okay lang po ba yun sa inyo? Okay po. And next is we need to explain the purpose of the medication. So, how it helped and using the language that the client can understand. This is the purpose of this, sir, is to provide a medication that the client requires, such as yung heparin and insulin nyo. So, and also, we need to educate the client na yung subcutaneous injection site natin is need to be rotated and orderly fashion to minimize yung tissue damage, aid absorption, and also ma-avoid natin yung discomfort. So, ito pong medication na to is allow yung slower absorption of the medication compared doon sa ating intramuscular and intravenous route. Okay po, sir? Okay. So, next is we need to select the clean site. So, yung siselect natin is free from tenderness, hardness, swelling, yung scarring, itching, or yung burning, or yung localized infection. So, we need yung select nating site that is hindi po yung laging nagagamit. So, ito po yung ating site, yung sa arm po, sa likod po ng arm ng ating patient. This we need to apply clean gloves. Okay. And as the agency protocol, we clean the site with the Antiseptic Swab. So, we need to start dun sa center at the site and clean in widening for about 5 centimeter or 2 inches. We need to allow the area to dry thoroughly. Ang ating site sa likod po ng arm ng ating patient. So, using the antiseptic swab is we need to clean yung ating injection site. So, in a circular motion from the center, papalabas. Okay. And then after that, discard. And we need to place and hold the swab between the third and fourth fingers of my non-dominant hand, or position the swab on the client's skin above the intended site. So, ganyan po. And next is we need to prepare our syringe for the injection. So, we remove the cup. So, i-remove po natin yung cup while waiting for the antiseptic to dry. Need to dispose yung ating needle cup. And then next is we need to inject na yung ating medication. We need to grasp yung ating syringe with my dominant hand, holding it between your thumb and forefinger, with palm facing to the side or to the upward for a 45-degree angle insertion, or with the palm downward pagka naman 90-degree angle insertion. And we need to prepare to inject. Using my non-dominant hand, ipipinch ko lang po. And then, gagamit po tayo ng 45-degree angle. Okay? And then, once na yung needle is inserted na, we need to move yung my dominant hand doon sa endong plunger. Or meron namang mga nurses na nakikita nilang mas madali if yung i-move nila yung non-dominant hand nila doon sa barrel of the syringe and yung non-dominant nila doon sa endong syringe. And we inject yung ating medication by holding the syringe steady and depressing the plunger with a slow, even pressure. And then, hawakan ko yung barrel. And then, slowly inject the medication. Okay? And after that is we remove the needle and then discard doon sa ating appropriate trash bin. And then, if meron pong bleeding na nag-occur, so pwede po tayo mag-apply ng pressure doon sa site with the dry sterile gauze until mag-stop na yung ating bleeding. After that, after injecting, is we need to dispose yung ating mga supplies appropriately. So, we remove our gloves and discard. And we need to perform hand hygiene. And we document all the relevant information, such as i-document po natin yung medication given, yung dosage, yung time, yung route, and also yung ating assessment. And that's all for my written demonstration. Or